Happy Friday, everybody.
Hello.
We are here live again every other Friday. This is Married to Health. My name is James Marin, Integrative Registered Dietitian.
I'm Delia Marin, Registered Dietitian Nutritionist.
And welcome to another episode or installment of this wonderful Good Gut series. And we are here live. So maybe you're watching us on different platforms. So we're happy to be here live with you. And today we're going to be discussing your SIBO IBS care team. So for those that aren't aware, we have our own private practice. We see a variety of clients, but we focus, the nexus is really gut health, right? All roads lead back to your gut. And one of the specialties that Delia and I both specialize in is SIBO and IBS. And so if you haven't watched our past videos, go back and do so. I highly recommend it. Today, we're going to be focusing on the care team. So what does that look like? Like who's part of this tribe to help you get better? So that's what we're going to be focusing on today. Anything to add to that?
No, I'm excited to talk about this because I often hear from my patients, my care team doesn't know what to do with me. And oftentimes what I find is perhaps maybe the care team isn't robust enough and maybe we want to bring in additional members to the team. So knowing who those people are, knowing how they can help, and knowing where to find them is something we are passionate about discussing.
Yeah.
Because we always want you to feel empowered to say, okay, it sounds like I could consult with this person and that could be helpful.
Right. And so often we hear from our patients really like, my doctor, fill in the blank, any healthcare professional, said it's in my mind or unfortunately, when someone doesn't know something, they're just like, oh, well, they might send you down another pathway that maybe isn't right. Or you hear a lot of kind of gaslighting in a way of just like, oh, that's not really a thing. Or, nutrition.
All your tests came back normal, so you're okay.
Right. Your EGD looks normal. Your colonoscopy looks normal. So there couldn't be anything wrong, right? That covers everything. So it's all in your head. Go home. Don't worry about it.
And I think what happens a lot of times, I don't think that any practitioner, we all enter into the profession of healthcare because we want to help people. I've never seen someone go into healthcare with the intention of hurting people or saying, I hate people, so I want to go into healthcare. We only know what we know. So I think the more that you can broaden your healthcare team and get more opinions from those with different types of experience, I think that is only something that can be incredible for you.
Totally.
So we want to let you know that if your care team has felt like it hasn't helped, or your care team has felt like they have come to the end of the road, they've exhausted all the options, they've ordered for you everything that they feel they could order for you, and they just feel like it's all in your head, or, I've got nothing for you. All my tests came back normal. Don't fear. Don't feel like it's hopeless. Just say, okay, who else do you suggest that I see?
Right. And so, obviously we're registered dietitians. We're typically part of this care team, but who else can be part of this care team, right? Like where is this starting?
And I always like to start by just always reminding people what we as dietitians can do on the care team and what position that we can serve on a care team. A registered dietitian is the expert on food and nutrition. It's interesting, especially in the last probably decade, where we have all of these random health professionals, and I appreciate that they're trying to spread the message of nutrition, but you have a lot of people saying a lot of different things. Some of it is evidence-based, some of it is not. Some of it is an interesting theory that they might present, but it might not necessarily be accurate information. So a registered dietitian is somebody who can help you find expert tailored nutrition advice. And really, a registered dietitian should not have just a template to give the same template to every different person. They should be able to customize it depending on your specific food intolerances or sensitivities, your specific conditions.
And the fancier word for that is medical nutrition therapy, right? It's MNT. It's customizing your MNT, your medical nutrition therapy, and working with that medical team or your care team and customizing that plan.
So diet is what we do. And then even nutraceuticals or supplements are what a dietitian can do. So that can be important because we know some GI disorders can be resulting from malnutrition or nutrient deficiency. So helping you identify and correct those is also something important. And what I always like to tell my patients also is I serve as almost a translator on their care team. They will let me know, my chiropractor said this, my naturopath said this, my doctor said this. What do you think? And I'll help them kind of translate. They'll bring me specialty labs or imaging or, scans, and they'll say, what do you think? What's your interpretation? This is what my care team said, but, what do you think? So it's always nice to be able to give just that second opinion. And, we speak medical language. We speak medical terminology as well. It's one of the languages we had to learn. So that's us as registered dietitians. All right. So next up for IBS, SIBO, EMO, intestinal microbial overgrowth, probably the other two that all of you have on your care team or should have. One, a primary care provider, whether that is an MD, a DO, a PA, an NP. So a medical doctor, doctor of osteopathic medicine, nurse practitioner, physician's assistant. They can help ensure that all of your primary care needs are met, and they can help with ordering labs. Oftentimes, if you do use insurance, they can order lab testing, standard lab testing, or specialty lab testing if it's needed, or imaging or other procedures through your insurance. So having that person who's just kind of your central go-to for things is important. So having that primary care provider, they might be able to be the one who has identified, these gut issues seem interesting. Let's get you linked in with a dietitian, gastroenterologist. Let's broaden your care team.
Yes.
So that might be kind of at the core.
And we get this question a lot, like, can you guys order labs? Can you guys order all my testing? And we can order testing to a certain extent, but especially if you have insurance, like we take most PPO insurances, but if you have insurance and you want to go through your insurance, you're typically going through one of your specialists. So if it's not the gastroenterologist, then it's your primary care provider, and they will be ordering your CBC or your metabolic panel or your thyroid panel, and really, getting into that baseline testing. I'd say if you're going to do specialty testing, breath testing, a NutriVal or other nutrient components, we can order that to some extent. So
depending on where you live.
That's a whole nother episode.
Yes.
Stay tuned for that.
We have an episode all about different testing.
Yes.
So you have your primary care provider, and it might be an integrative physician, it might be a functional physician, it might be a naturopathic physician. So somebody who you feel can kind of give you opinions on both sides. So somebody who's not always going to say, take this herb, this is going to, cure that. Because now I think what's interesting is, and I'm not hating on it, I appreciate it. We're integrative. I've been trained in functional nutrition, but I often have patients who might see somebody who's functional or integrative, and instead of the pill for every ill that people talk about that they don't love about Western or allopathic medicine, here's a supplement for every
we gotta
every
come
ill.
up with a rhyme.
So
a tablet for every.
Yes, something. So it's interesting because it almost becomes over supplementation, or it becomes polypharmacy with supplements now.
Yeah.
And again, it's not always the supplements that are going to do it for you. So find somebody who you feel comfortable with, who you feel confident is going to help give you that opinion of, sure, a supplement can help with this, or diet change can help with this, or you know what? No, we actually need a little bit more help from additional specialists and additional information. And maybe this medication is something that might be in your interest. So medicine, you guys, I know so many of you have kind of been disillusioned by Western medicine, and we hear it. We hear you guys every day. My patients will tell me different things, and they feel a little bit disillusioned. It's definitely a blessing, and it's definitely here for a reason. So if you need it, please use it. If you're having rectal bleeding, or if you're having symptoms of, possible inflammation in your colon, please have a colonoscopy. These are tests that are here so that way you can avoid disaster, like getting your colon removed.
They can be life-saving, and we've seen this many times in our patient. We've had direct experiences with this with our patients of it was life-saving that they got a colonoscopy. They were in really bad trouble, and it's assessing where you are. They
might have had just
fistulas that were
extensive disease.
So
it's not all bad. Not all medication is, over medication. I can't say that. I take medication myself. I've shared openly. I have an autoimmune condition. I have an autoimmune thyroid condition, and my immune system destroyed a part of my thyroid. It's not going to regenerate itself. So I do take thyroid medication. I'm grateful to have that opportunity to take medication. So when you need it, use it. Right. Sure, we don't always want to jump right to it. Discuss that with your care team if that's not what you want, because ultimately it's your body. Right. But just knowing that you have it is nice, and, taking both sides. So I love how someone commented that I do this to myself and I load up on too many supplements. And a lot of times I see that with patients. They come to me and they're like, well, I've taken this supplement, and they're on 12, 14, 15 different supplements. That has risk too. So just knowing that, but there can be ones that are helpful.
And the context with Dahlia's thyroid is she's on like 99% less medication though, right? Than if she wasn't living a healthy, sustainable lifestyle.
But a lot less.
Around there. No, but yeah, so the context matters. And all this to say, everything that we're saying is getting information. Why would you have these specialists and you have your primary care doctor and you're seeing different members of the team is to gather information. You have to know what is going on so you can properly have the right action plan to address what is going on, right? So it's gathering this data, it's collecting this information. No one's ever been around a problem, it doesn't matter what type it is, and gone, you know what, I want less information about this problem. Everyone's like, I need more information on this problem. The more you know, the better decisions you make. That is what this care team is all about. The more of these specialists you have, the more opinions and the more we can dig into this, the better the plan you can have, which is essentially the goal for this.
And at the end of the day, it's your choice if you want to do something or not. But like James said, if you have the opportunity to gather the information, I think use that opportunity. And it's so important. So it could be a gastroenterologist also who's one of your specialists. And of course, like we mentioned, they can order things like endoscopies, colonoscopies. They might order different motility tests, breath tests, like we had mentioned. So a gastroenterologist is trained to really help you address some of these issues. And again, specialists can subspecialize. We are specialists. We're dietitians. We're nutrition specialists. But that doesn't mean we specialize in everything. So our subspecialty is SIBO IBS. I don't specialize in cancer or sports nutrition. So not every gastroenterologist might specialize in your SIBO or, IBS, if it is SIBO or EMO. So finding that gastroenterologist who is versed in that, asking them the questions, and we'll talk about what questions to ask, is important.
Yes. So we have primary care provider, registered dietitian is a must, guys. Of course, we're biased. And then a gastroenterologist. What can be next?
So next is if something's going on where we feel like there might be something involved with part of the endocrine system. So perhaps it's thyroid, it's adrenal driven, that gut-brain connection can be very important. You might see an endocrinologist. And we've seen this happen with patients. I know for me, before I was diagnosed with thyroid issues, I had a lot of gut issues because I had slow motility, slow movement. And I see that in a percentage of my patients as well. So they oftentimes are going to work with an endocrinologist who can help get their thyroid on the right track, or if they're diabetic, that can also involve the gut. They might be having diabetic enteropathy. They might be having some of that neuropathy in the gut. An endocrinologist is an important member of the care team to help with their diabetes, along with their primary care and their dietitian. So yes, absolutely.
And this next one is very much in line with gut problems. So what is the next one?
So next we have rheumatology. It's interesting because I think we're starting to come out with more and more research and starting to realize more and more that autoimmune conditions can very much be tied in with the gut. We see with a lot of these cases, or, in many cases, that there can be a component of intestinal hyperpermeability, leaky gut. And this can manifest in different areas of the body. So a rheumatologist is somebody who is versed in diseases of, the joints, the immune system, and overaction of our immune system. So seeing a rheumatologist, they can help you get appropriate testing so they can help you determine what type of autoimmune condition you have. A lot of times, maybe a primary care physician might run an anti-nuclear antibody test, ANA. And this is non-specific. This will just kind of estimate or guesstimate if there's any type of antibody process or autoimmune process going on in your body, but it doesn't differentiate. It won't tell you it's probably lupus, rheumatoid arthritis, Sjogren's. And a rheumatologist can help kind of differentiate and tell you what's going on. So a rheumatologist might be extremely helpful. We also know that some of these rheumatic diseases and autoimmune conditions can manifest in the skin. There is also involvement with the gut. So having somebody who's versed is a good idea. And what's exciting, we have colleagues who are integrative or, studying integrative rheumatology, functional rheumatology. So shout out, we have Dr. Micah Yu, who's, really interesting rheumatologist. So there's more of these practitioners, you guys, who are looking deeper and want to know a little bit more. All right.
So next on the list would be a pelvic floor therapist. Now, I know a while back, I hadn't heard of this, like, pelvic floor therapy. I didn't know that was like its own thing. I didn't know, and many of our patients are like, what? Like, what are you talking about? What is that? Like, how do I do that? And how does that make sense? How does that affect my gut? And so it's very, very important to understand this pelvic floor is kind of setting the stage almost for your gut and for the anatomy, right? The support. If you're thinking of all the tubes, your small intestine, your stomach, your large intestine, that's all inside of you right now. What is it doing? How is it staying intact? How is it moving properly? And how are we making sure this anatomy is all working together? A lot of it is structural. This is a big part of that structure. And there are many ways that structure can get a hairline fracture, right? Or it can be offset in many ways. Car accidents, falling, even at a younger age, and just these physical abuse we can all put on our body can have a huge impact, even years down the road.
So a pelvic floor therapist is a physical therapist who's specifically trained in the muscles of the pelvic floor.
Right.
Those surround, parts of your intestines, your rectum, the bladder. So for those of our patients who are having issues with frequent urination, maybe they've had a cystoscopy and they've identified maybe it's interstitial cystitis, inflammation of the bladder. Maybe they have identified that they cannot pass bowel movements effectively. I have some patients who tell me, I want to poop and I feel like I have to poop. I can tell there's poop there, but when I try to go, only rabbit pellets come out. That might be an issue of your pelvic floor muscles. These muscles are supposed to relax and contract at appropriate times, to allow things to pass through. So it's almost these little doors that open up when, all the conditions are right. Your muscles relax, you are having that proper, flow. Absolutely. You're sitting ergonomically on your toilet. When all those things align, you're supposed to be able to pass your bowel movement. If you feel like a little pellet came out and then the bridge closed back up, that can be a pelvic floor issue. So I very often will recommend, especially I will say to my female patients, but I have referred male patients also to pelvic floor therapy. It's not only a female issue. We are more susceptible, especially after childbearing. So I have one patient who she's like 100 pounds. She's had 4 pregnancies and she has big babies. That's a lot on her pelvic floor. And she noticed that these issues started happening and they worsened with each pregnancy. So it could be a pelvic floor issues. Those muscles might need a little bit of work. So that way you're improving that communication, the nerve signaling, the relaxing and the contracting.
And this can get so deep, like what we said, anatomy and structure and physiology. And it also speaks to the biochemistry in your body, the nutrition in your body. So this is where nutrition can come in, getting those proper electrolytes, getting the proper minerals like calcium and zinc and magnesium, which are important for smooth muscle and the more functional muscles we have in our body, and making sure the signals are firing correctly and things are working correctly, as well as the structural, like pushing a big baby out of you, which is a big change structurally to your body and your anatomy. So this is where a pelvic floor therapist can come in big handy.
And I think the misconception that patients often have are like, oh, well, I do Kegels. And they think that that's all you do in pelvic floor therapy. I'm amazed every time I learn more about pelvic floor therapists because they might use different tools. They might use different techniques. It's not just Kegels, you guys. And they're not just going to tell you to shove a yoni egg up your, up your vagina. So like I said, they see male and female patients, and pelvic floor therapy can often be important important. And segueing into that can be not only pelvic floor therapy, but other physical therapy.
Yes.
I know I have referred many of my patients to physical therapy for just other issues, overcompensation. A physical therapist can help, again, re-strengthen and revive any type of loss of function. I have also referred several of my patients to physical therapy when they're having upper issues. So, esophageal issues, maybe they're having constant reflux. Physical therapists who are trained, who can help you retrain your diaphragm, help you practice, diaphragmatic breathing.
Good posture. I noticed my posture right now when you said physical therapy.
Right. So they're going to help you with that as well. They can help with minor adjustments. I had a patient who had really severe reflux. I recommended, she tried so many things. She had so many tests. So I was like, hey, let's try physical therapy. She's doing 90% better. So for her, that was the thing. The strengthening the muscles, having very slight adjustments with the physical therapist. This for her was extremely helpful. So a physical therapist can, again, work from top to bottom. So that can be helpful. And that, other physical medicine. So in there you have chiropractic care. Again, adjustments can be helpful. Chiropractors or acupuncturists, we often refer to acupuncture as well. They can help with things like cupping. Acupuncturists can do acupressure, where they're physically manipulating the gut. I have patients who do acupressure and they feel better after their sessions because it helps kind of physically move things along.
Right.
Acupuncture, as we know, uses needles to help bring blood flow back to areas, can help reduce inflammation. So if part of somebody's IBS, SIBO symptoms is inflammation, acupuncture can help.
Any of you naysayers out there for acupuncture, I just like to add this little tidbit of information, and it really just speaks to a basic understanding. I think an understanding we all can agree on, right? Which is because with acupuncture, you're using the little, I don't know the exact terminology for the needles, right? But the little needles you're putting in, I think they have a different term for them. And they're going on your meridians, and it's with also the pressure as well. But the acupuncture is also using the needles, and you're using that meridian, and it's based on energy. Some people poo-poo on that. They're like, oh, there's not enough research, or there's a lot of research.
There's a lot of evidence to support acupuncture. There are multiple studies available. You can look them up on PubMed.
Right. So that's one point. Now, another point is, what do we all learn in like junior high or even elementary school? And that is the idea of an atom. At the end of the day, we are atoms, right? We're made up of these elements, and these elements are tiny little molecules called atoms. Now, what is an atom? It is a nucleus of positive and neutral electrons with negative electrons around it. It's essentially energy. So at the end of the day, guys, we're all energy. That's why when I say something mean to someone, their energy changes. When I say something nice to someone, their energy changes. So energy is pretty cool. We could do a whole episode on energy, but this is where acupuncture can be very, very beneficial. Lots of evidence, and it speaks that basic logic and understanding of utilizing your own energy. So really cool.
Not only that, it is very relaxing oftentimes. I know. I love going to acupuncture. So many times I'm seeing patients who are very often in fight or flight. So they're very much in sympathetic mode. They're producing a lot of those stress hormones. And we know that can affect the gut. We know when we're stressed and we're producing more of those adrenal hormones, we are changing our physiology. Oftentimes you produce less mucus when you are highly stressed and producing those stress hormones. So that might affect your mucosal layer, your mucosal lining of your intestines if you have this, prolonged, especially. Also, when you're stressed, you can shunt less blood to the gut. So that can decrease your rate of motility or movement in your intestines. So we know very much so that stress impacts your gut. Acupuncture is also it's relaxing. So it can help encourage you back into that parasympathetic rest and digest, feed and breathe. So that way you have that chance where you're scheduling you time. Even if you think of it, if you don't believe in the science of acupuncture, even just the self-care aspect of it, you're scheduling time and you're caring for yourself. So that can be important. On that note of self-care, I think I'm so glad that we're destigmatizing therapists and mental health counselors. This is such an important part of your care team. So having somebody who you trust to speak to your traumas, to speak to your daily stressors, to have that relationship with can be very transformative. So often, I will say, with my GI patients, I especially see this with weight loss patients and others who are struggling with ongoing issues. They come to me and they want a diet plan because that's what I can provide. And so many times I'll tell a patient, I'm very straight up with patients because I love them and I care about them. I'm very real with patients, and I often say, honestly, you don't need me. You might need me along with a therapist, but you need a therapist more than you need me. Clearly, this is an ongoing pattern. And this can speak to gut issues because I have many patients who fall into this. They might have constant cycles of binge eating or disordered eating patterns. And that's what triggers their symptoms to get worse. And every time they fall in the cycle, their symptoms get worse and worse and worse. Well, we can prevent the gut issues from worsening if we stop the disordered eating.
Right.
And so working with a therapist who's versed in that, even if it's stress induced and it might not qualify as 100% disordered eating, but there is kind of signs of it, a therapist or a counselor can be so important on the care team. Again, just speaking to that stress as well. Having somebody who you can help kind of navigate and create a plan is so important. So if you still feel stigmatized, if you still feel embarrassed about talking about your mental health, please know that especially after this last year, which was traumatizing for all of us, that there is no shame in it, and taking care of your mental health is so important. So I'm so grateful for all the therapists and mental health counselors out there.
Very well said. Nothing to add to that. That was great. Yes, so important.
Right.
I mean, that is excellent.
And then the last couple ones that we have left are, again, other physical practitioners. So in speaking about, physical therapists, acupressure, chiropractors, massage therapists as well. So especially those who are versed in visceral manipulation therapy, whether a patient has scar tissue anywhere in their intestines, a well-versed visceral manipulation therapist can help kind of break up or help massage that scar tissue so you have better flow. Even it might take years and maybe even possible surgery to break up scar tissue sometimes, but just to enable passage and better flow can be really helpful, and that can help with reflux. It can help with constipation. So a trained massage therapist, you can ask them, do you know visceral manipulation therapy? You can definitely find solace in somebody like a trainer or a yoga instructor or at the gym. Physical movement is important also for the intestines. I often ask my constipated patients, in conjunction with other things, to exercise, walk, ride a bike, go on a jog, get your intestines physically up and moving. So
I'm going to do TMI, but it's part of my routine. Part of my bowel movement routine is exercising, and then I have my bowel movement in the day. So that is just, that's part of my clockwork. And I'm sure that helps me. I mean, obviously there's times I don't exercise. It doesn't mean I don't have a bowel movement, but it's part of my clockwork to know this is my schedule. I exercise, then my wonderful bowel movement happens. We should celebrate those times of the day. They're wonderful times of the day. They're healthy.
And we hope that they become wonderful for you if they're not right now.
Yes. So very, very important.
So if they're not, you might consider getting in some physical movement, and that might happen in yoga. The other things that can happen in a more relaxing exercise like yoga or Tai Chi, we know are things like deep diaphragmatic and breathing into your diaphragm. You guys, I had this experience, we were filming some content with our friend who's a physical therapist, and he was telling me, okay, breathe into your belly, practice diaphragmatic breathing. And I was like, I am. And he said, no, you're not. I can tell you're still sucking in. And I always do it. I'm kind of holding in my abdomen, and oftentimes we're told to do that. And that's good for your pelvic floor and, different reasons. But we are so accustomed to kind of holding those muscles in, we have a hard time letting it go. Truly breathing into your low belly, your diaphragm. So that diaphragmatic breathing is often sometimes happening in yoga class. So, especially if it's more of like an Ashtanga, Vinyasa flow, you're practicing your breathing.
Let's all breathe together right now. Ready?
And what I like to recommend, that was a good breath, James. I like recommending box breathing. So doing things like inhaling for 3 to 5 seconds. James can demonstrate. You can hold it for 3 to 5 or even up to 7 seconds. and then slowly exhaling for anywhere from 3 to 7 seconds, whatever feels good for you. This can happen with a closed mouth where you're breathing down the back of your throat. This can happen out of your mouth like James is showing here. Studies have shown that practicing that deep diaphragmatic box breathing
does feel good.
Can help your nervous system. That
yeah.
exhale especially is going to stimulate something called our vagus nerve, and it's going to help calm our nerves, calm our system down. That can also help with motility. So in yoga, in one of these more, relaxed styles of exercise where you're not shallow breathing, you're not necessarily doing intense
So not
cardio.
HIIT training, like intense circuit. Like,
yeah, no, probably
like
not
you
that.
only get 20 seconds
That's
to
good
rest.
for physically moving your
right.
intestines. But again, if you want to calm your nervous system, practicing something like that can be a little bit more helpful.
Perfect. And
all right.
Comment below, guys, if you want us to do a whole episode on just breathing. We'll just all breathe together and meditate together. That would be cool.
Check out our stories if you're watching this today. But we posted, in our stories how important breath can be, doing things that calm your nervous system. So I posted just the ocean waves and commented on box breathing. So hopefully your care team is addressing all of these different facets. So we talked about so many different providers that you can have on your care team. We talked about specialists like gastroenterology, endocrinology, rheumatology, might have other ologies in there that you might see a dermatologist if you're having also leaky gut and skin issues from that. We talked also about physical medicine, and we talked about seeing things like seeing people like physical therapists, chiropractors, acupuncturists, massage therapists. We talked about mental health. And then the last one that I didn't get to mention was speech therapists or occupational therapists. If you are having any type of upper motility disorders, a speech or occupational therapist can be helpful with that. It's also helpful a lot of times for kids if kids are having, swallowing issues, but adults as well. We hope all of these care providers were helpful. And we're going to just really briefly talk about what questions you want to ask your care team. And this can be a whole episode in and of itself. So we can briefly touch on these, but we definitely want to expand on it because I know we've gone already for, over 30 minutes. But, asking your providers what other providers they're versed with. Do they think they're going to be your end all be all? That's usually a red flag. That practitioner might not be as versed in what you have going on. If they think, I'm just going to give you this pill and you're going to be good, you're going to be on your way. Or as a dietitian, I'm just going to give you this diet and you're fine. That's all you need.
That's all you need as a dietitian for SIBO and IBS, right?
Kind of a red flag. So we're going to talk all about asking about different tests that they can help you perform, how many patients they've worked with what you have going on, how they're going to help you identify your root cause, and what's their usual protocol. So we're going to dive into this more deeply, definitely in another day.
Yes.
But we hope this was helpful. We hope just knowing who we recommend as registered dietitians who specialize in the gut for adults and kids with that specialty in SIBO and IBS, just hearing the different types of practitioners we refer to on a daily basis. We are so grateful to have other amazing practitioners to refer to. And whether it is more Eastern, whether it is more Western, we so appreciate having that gamut and really collaborating on your care team. And the most important member that you have to remember on your care team is you. You are the director.
We saved the best for last.
So if ever you feel like my care team's not listening, my care team's gaslighting me or discounting what I'm saying, guess who can fire your care team? You.
Yep.
So if you don't feel like you have an appropriate care team, you can look for a new one.
Yeah. So take this knowledge, take this power. We hope you use it. If you have any questions, comment below. As always, those that are watching from our Good Gut group, you can ask questions anytime during this live. So that's just a reminder. We will answer them here live for you. And so, we hope you take this knowledge. We hope you have a wonderful weekend. We hope you, if you need to, fire some people on your care team or go out and look for others on your care team.
Upgrade them.
No, just fire them. No, I'm just kidding. Upgrade them, right, and replace them and do what you need to do. Again, it's all about obtaining this knowledge. That's why you have such a diverse care team if you do, or maybe that one person that's on your care team, you need to diversify. Diversity is always a good thing, whether it's in your diet or in your care team, it's a win-win. So that's what we're here to help you do.
Yes. And we hope you heard about new things. If today was the day where you heard about pelvic floor therapy or seeing a speech therapist and it resonated with you, we hope this empowers and encourages you to get out and seek them. If you want to have us on your care team, you can head to our website, see if you are somebody who can work with us and how you can make an appointment. For those in our Good Gut group that is exclusive to our patients, we answer questions. So during these lives, when our members of our Good Gut group have questions, we answer them here and provide so much more.
All right, everybody. Have a wonderful day. And we hope you have a great weekend. We will see you soon. Remember, we're here every other Friday live, and we have a ton of great topics to cover. Like you've seen today, we can easily do 30 minutes. So we can talk till Dahlia coughs out her lung. So that's 100% sure that we can do. So again, have a wonderful day. We are so grateful to have you all here watching, and we will see you in a week or two.
We hope you heal with each meal. And if the food isn't doing it for you, we hope someone else on your care team can help you get there.
Yep. Bye, everybody.